بسم الله الرحمن الرحيم. محاضرة اليوم General Anatomy هي استمرارية لمحاضرات الهيد and neck region. كملنا بالمحاضرة السابقة هي الهيد. Now we start with the neck region. The neck is the second part of head and neck region that connects the head to the other parts of the body. It is a relatively narrow and flexible portion between the head above and chest below. Its function: transport food tube and air tube and neurovascular bundle between the head and chest. And second, the upper limb originates from the cervical region during their embryological development. And the third thing, passage away for blood vessel and nerve to and from the upper limbs. This is the function of neck. Well, we start with the boundaries of the neck. Any part of body you have superior, inferior, lateral, medial, anterior, posterior boundaries. We start with the superior boundaries. Superiorly, for anterior view, the lower border of the mandible. At the side, laterally, line between the gonion and the mastoid temporal area. And posteriorly is below the inion and superior nuchal line. This is the superior border of the neck. Now to the inferior border of the neck that is related to the chest inlet. Anteriorly, the jugular or suprasternal notch. Laterally, the superior border of the clavicle. And posteriorly, transverse line from the acromioclavicular joint to the spinous process of the 7th cervical vertebrae. That it is the inferior border of the short note about the surface anatomy of the neck. The contour of the neck well rounded in women and children and is more angular in men. Naturally, upright position of the neck is midway between flexion and extension of the head. The skin of the neck is a natural line of cleavage of skin are constant and run almost horizontally around the neck. The structure palpated in midline and from anterior view, we have the body of hyoid bone, thyroid cartilage, precox cartilage, the trachea in upper border in the neck, and isthmus of the thyroid gland, and finally, in lower part is suprasternal notch. The structure palpated posteriorly from the inion in the occipital region to nuchal groove, vertebral prominence, and ligamentum nuchae, which cover the spinous of the from 2nd cervical vertebrae to the 6th cervical vertebrae. Laterally, the structure palpated is the sternocleidomastoid muscle, is a very big muscle that is a good landmark for the neck. And we have trapezius muscle in the posterior border of the neck, and we have external jugular vein between the sternocleidomastoid muscle and trapezius muscle. Now, the bony skeleton of the neck. Like other regions of the body, the neck has central bony skeleton core upon which other structures attach or are related. The bone of neck consists of the base of the skull and 7 cervical vertebrae. If we take a look at the base of the skull, the major parts that are related to the upper neck are the first, as this figure we can see, the number 1 is foramen magnum, the number 2 occipital condyle articulated the superior process of atlas, and number 3 in the occipital bone, the external occipital protuberance, and the mastoid process is a number 4. This is the base of the skull of the one of the bony structure within the neck. Now, below it, you have cervical vertebrae. Below the base of the skull, you will find the vertebral columns. The top vertebrae, 7 cervical, provide support for the neck structure. You will also note that these vertebrae allow passage of an important arterial supply to the brain and the brainstem, the vertebral artery that passes through this cervical vertebrae. Now, the first cervical vertebrae is C1, is atlas. It's called atlas. That it is like the حقيقة تشبه إلى أطلس اللي يحملنا الكرة الأرضية على عنقه. أيضا the first cervical vertebrae that can hold all the skull above it. It is considered an atypical cervical vertebrae. It is not a typical cervical vertebrae. Why? Because it has no body or spinal process. It articulates the occipital condyle of the skull above and with the superior articular process of the axis below, the second cervical vertebrae. It also articulates with the dens of the axis below. If viewed from above, you can identify the following part of it. This figure shows the parts of the atlas vertebrae per cervical vertebrae. Number 1 is anterior arch. Number 2, anterior tubercle. Number 3, the superior articular process articulate with the condyle of the skull. And below it, the inferior articular process that articulated with the second cervical vertebrae. Number 4 is foramen transversum. Number 5 is transverse process. Number 6 is posterior arch. Number 7 is vertebral canal that continue with the foramen magnum at the base of the skull. The brainstem continue inferiorly as spinal cord at margin of the foramen magnum. نلاحظ انه the first cervical vertebrae is a ring-like shape and have no body that is go within the second cervical vertebrae and fuse with it and form dense process. The axis, the second cervical vertebrae. This vertebrae is also called an atypical vertebrae because it has an upward projection called dens that they articulate with the inner aspect of the anterior arch of atlas just posterior to the anterior tubercle. Some of anterior part of the second cervical vertebrae, we can see it in this figure. Number 1 is the dense process. Number 2 is the body of the second cervical vertebrae. Number 3 is superior articular process. And below it, the inferior articular process. Number 4, that is transverse process with its vertebral foramen. Number 6 is the pedicle. Number 7 is the lamina and is bifid spine. This is the structure of the axis second cervical vertebrae. Now go to the third, fourth, fifth, and sixth cervical vertebrae. Is known as a typical cervical vertebrae because they all have the same characteristics and except for the foramen for vertebral artery similar to the other typical vertebrae of the spinal cord. The structure, that characteristic feature of this, as you see in this figure, number 1, the body, number 2, the pedicle, number 3, foramen vertebral artery, number 4, superior articular process, and below it, the inferior articular process, number 5, the lamina, number 6, the spinous process with bifid in case of cervical vertebrae, number 7, vertebral canal, number 8, transverse process consists of glue that carries cervical spine, nerve, and of course the foramen for vertebral artery. The 7 cervical vertebrae start to pick up characteristic of the upper thoracic vertebrae. Difference from other cervical vertebrae, no foramen for vertebral artery. After the vertebral artery arises from the subclavian artery, it enters the transverse foramen of the 6th cervical vertebrae bypassing the 7th cervical vertebrae. May not have a benefit spinous process. The spinous process of the 7th cervical vertebrae is longer than other cervical vertebrae. Is not buried under the ligament nuclei of the neck, so it is easy to see and to palpate. and is called the vertebra prominence. Can serve as surface landmark demarcating the neck cervical from the thoracic region of the body. حقيقة, there are three atypical cervical vertebrae, the first, second, and seventh cervical vertebrae, and the four typical cervical vertebrae from the third, fourth, fifth, and sixth cervical is typical. This figure shows the part of the seven cervical vertebrae. The last cervical vertebrae is atypical due to the not present vertebral foramen, and we have long spine, but not bifid, and we have two transverse process and that have a body within the center of the vertebrae. Now we go to the major landmark within the neck. From anterior view, we have common carotid artery at the bar side, and internal carotid artery and external carotid artery, and at bifurcation of this, the carotid sinus. The lateral view, the superficial structure from lateral view of the neck, there are the sternocleidomastoid muscle, trapezius muscle, occipital lymph node, retroauricular lymph node, superficial cervical lymph nodes, submental lymph node, buccal lymph node, parotid lymph node, submandibular lymph nodes, not labeled but another angle of the mandible. There are certain abnormalities within the superficial structure of the neck. The most important, the swelling of lymph node, a sign of infection in an area of that is drained by the node. The superficial group of node in the neck drain the skin of the face, nose, scalp, and external ear. The submental lymph node also drain the tip of the tongue. Deeper region of head and neck drain into deeper group of lymph node and are less palpable. And we have other important landmarks within the superficial landmark of the neck. First, the cartilage of the larynx and trachea, and we have thyroid gland is closely associated with the cricoid cartilage, and we have tracheal rings, and we have carotid artery. The carotid artery pulse can be felt by pushing lateral to the upper border of thyroid cartilage, just under the anterior edge of sternocleidomastoid muscle. Now, the triangle within the egg. We have divided the triangle to two triangles according to its location within the sternocleidomastoid muscle. We divided it anterior triangle and posterior triangle. Now we start with the anterior triangle of neck. The neck is arbitrarily subdivided into two triangles by sternocleidomastoid muscle, the anterior triangle and posterior triangle. The anterior triangle is divided to four triangles: submental, submandibular, muscular, visceral triangle, and carotid triangle. And the posterior triangle divided into triangles: the first occipital and second supraclavicular, or call it homoclavicular triangle. Starting above the hyoid bone in the anterior triangle, we have two small triangles, submental and submandibular triangle, or call it digastric triangle. We will start this study by looking at the submandibular triangle first, then submental triangle. Now, the anterior triangle. The boundaries of anterior triangle from front by midline of the neck, from behind the anterior margin of sternocleidomastoid muscle. The base of this triangle is upward, formed by lower border of the body of the mandible, and the apex below at the sternal notch. This space is subdivided into four small triangles by digastric above and the superior belly of the omohyoid below. This smaller triangle are named the carotid triangle, submandibular, submental, and muscular or visceral triangle. The triangle with the anterior of triangle of the neck, we have, as said, four triangles from above the submandibular and submental and go down the muscular and the carotid triangle. We start from the submandibular triangle. It corresponds to the region of the neck immediately beneath the body of the mandible. Its boundary from above the lower border of the body of the mandible and mastoid process, from below the posterior belly of the digastric and stylohyoid process, from front by anterior belly of digastric. The floor of this triangle covered by mylohyoids muscle. Again, we give the boundaries of the submandibular triangle is above mastoid and the base of the mandible, anteriorly the anterior belly of the digastric muscle, from posteriorly the posterior belly of the digastric muscle and stylohyoid process. The superficial, the roof of its structure, submandibular triangle from skin, then the platysma, and we have facial vein and cervical branch of facial nerve within the roof of this triangle. The content of the submandibular triangle, anterior part, submaxillary, or call it submandibular gland, one of the major salivary glands, anterior facial vein, external maxillary artery, submental artery, mylohyoid artery, and nerve, external carotid artery and internal carotid artery, and the facial nerve. If removed of the superficial structure, display the submandibular salivary gland and itself. If the remove all the superficial structure from above, we can see the submandibular salivary gland and its structure. The content of submandibular triangle are structure passing through it: the facial artery, lingual nerve, and submandibular ganglion, submandibular duct, lingual artery, hypoglossal nerve. The lingual nerve and submandibular duct pass through a gap between the hypoglossal muscle and mylohyoid muscles. The lingual artery passes deep to the hypoglossal muscle. The second triangle is submental triangle. Its boundary behind the anterior belly of the digastric muscle, front the midline of the neck between the mandible and the hyoid bone, below the body of the hyoid bone. The floor is formed by mylohyoidus muscle, which aid in swallowing and depressing the mandible. The structure within this triangle is submental lymph node and drain the floor of the mouth. Some small veins that later unite form anterior jugular vein. The submental triangle is located between two anterior digastric muscles. Some book is called as one triangle, and others call it two triangle and separated by midline. The structure that within this triangle, submental lymph node, drains the floor of mouth. Mylohyoid muscle arise from body of the hyoid bone and inserts into mylohyoid line of the inside of the mandible. Aids in swallowing and depressing the mandible. The third triangle, call it carotid triangle, due to its the old carotid artery within it, the common carotid artery, internal carotid artery, and external carotid artery. Its boundaries above the posterior belly of the gastric muscle and stylohyoid process, below the superior belly of omohyoid muscle, behind anterior border of sternocleidomastoid muscle. Again, we discuss the boundaries of carotid triangle. First, posterior belly of the gastric muscle, superior belly of omohyoid muscle, anterior border of sternocleidomastoid muscle. Starting from the most superficial aspect of carotid triangle, we will point out of its isthmus that are related to it. The roof of the carotid triangle. The first layer under the skin and superficial fascia include the platysma, which form the roof of a carotid triangle. Note the location of the carotid triangle in purple. This triangle is like other triangle is the skin and the superficial fascia and the platysma muscle, and then the deep fascia. The floor of the carotid triangle is the deepest aspect of carotid triangle. The muscles at this level are middle and lower pharyngeal constrictor. The structures seen passing through this level are superior laryngeal nerve, branch of the vagus. It has two terminal branch. Internal laryngeal nerve is sensory to upper part of the larynx. External laryngeal nerve is a motor of the cricoid muscles. The content of carotid triangle, upper part of common carotid artery, internal jugular vein, hypoglossal nerve, vagus nerve, accessory nerve, internal branch of the superior laryngeal nerve, external branch of superior laryngeal nerve. The veins within the carotid triangle, with the roof moved from the area, the boundaries of carotid triangle and the superficial vein related to it, common facial vein within carotid triangle. Other structure is the retromandibular vein, posterior ocular vein, facial vein, external jugular vein, and anterior jugular vein, that all vein within the carotid triangle. The nerve within the carotid triangle, the nerve that enter the carotid triangle and that lie superficial to the internal jugular vein and internal and external carotid artery are the hypoglossal nerve, the first cervical root of ansa cervicalis, the first cervical fiber running with the hypoglossal nerve to thyroid muscle, the cervical 2 and cervical 3 root of ansa cervicalis, and the ansa cervicalis nerves. This figure shows the all nerve within the carotid triangle from C1, C2, C3, and the accessory and vagus nerve. After reflection of the sternomastoid and removal of common facial vein, you can see common carotid artery, external carotid artery, superior thyroid artery, occipital artery, lingual artery, facial artery, and internal carotid artery. So the more superficial structure is the vein, and after remove the vein, we can see the artery in deep structure of the carotid artery. This figure shows the arteries that within the carotid artery that after removal the superficial structure and the veins from the its roof of the carotid artery. The fourth triangle, the last triangle within the anterior triangle is muscular triangle, or call it visceral, due to the presence of viscera within the triangle, call it visceral triangle. Its boundaries in front by midline of the neck from the hyoid bone to the sternum, behind by anterior margin of sternocleidomastoid muscle, above the superior view of omohyoid muscle, is covered by integument, superficial fascia, platysma, and deep fascia. The muscular or visceral triangle, this triangle has following boundaries: midline of neck, the superior view of omohyoid, and the sternomastoid muscle. The muscle forming within the triangle are seen in image level. These muscles are often called the straps muscle for obvious reason. This superficial muscle is sternohyoid muscle, superior view of omohyoid muscle. Deeper layer, the thyroid muscle and sternothyroid muscle. The muscle forming within the triangle are seen in image level. The superficial one is sternohyoid and superior view of omohyoid. Deeper one, the thyroid and sternothyroid muscle. The content of the muscular triangle: common carotid artery, internal jugular vein, vagus nerve, inferior thyroid artery, the recurrent nerve, and the sympathetic trunk, esophagus, trachea, thyroid gland, and the lower part of the larynx. Now we have a short note about the thyroid gland and its arterial supply. When the strap muscles are reflected, you can see the thyroid gland with its arteries: superior thyroid artery from external carotid artery, and inferior thyroid artery from the thyroid trunk from the subclavian artery. If the thyroid gland is reflected laterally, the structure making up the larynx and trachea are seen. We can see thyroid membrane, thyroid cartilage, Adam's apple, and cricoid thyroid membrane and ligament, and cricoid cartilage and tracheal ring. The anterior view of the muscular triangle, we can see the thyroid gland is hidden under the sternohyoid and sternothyroid muscle and consists of two lobe and isthmus. An occasional pyramidal lobe extends upward near the midline. The inferior thyroid artery is closely associated with the recurrent laryngeal nerve. The deep structure surface of the thyroid gland from posterior view. We have four small reddish-brown bee-sized glands may be seen on the deep surface of the thyroid gland. These are the superior and inferior parathyroid gland. Also, not a close relation of the recurrent laryngeal nerve to thyroid gland and inferior thyroid artery. These figures summarize the subdivision of anterior triangle of the neck approach. We divide it into four triangles. The first one, submental triangle. Its boundaries, the mandibular symphysis, anterior view of the gastric muscle and body of hyoid bone. Its content, submental lymph node, the tributaries forming the anterior jugular vein. The second triangle, submandibular triangle. Its boundaries, lower border of the mandible, anterior belly of the gastric muscle, posterior belly of the gastric muscle. Its content, submandibular gland, submandibular lymph node, hypoglossal nerve, and mylohyoid nerve, facial artery, and vein. The third triangle is carotid triangle. Its boundaries, posterior belly of the gastric muscle, superior belly of the hyoid muscle, and the anterior border of sternocleidomastoid muscle. Its content, tributaries to common facial vein, cervical branch of facial nerve, and common carotid artery, external and internal carotid artery, superior thyroid artery, ascending pharyngeal and lingual, facial, and occipital artery, internal jugular vein, vagus nerve, accessory nerve, and hypoglossal nerve, and superior and inferior root of ansa cervicalis and transverse cervical nerve. The last triangle, muscular triangle. Its boundary, midline of neck, superior belly of omohyoid muscle, anterior border of sternocleidomastoid muscle. Its content, sternohyoid, omohyoid, sternohyoid, and thyroid muscle, thyroid and parathyroid, and pharynx, and the last inferior part of the larynx. Thank you for your listening this lecture.